Hello, everyone. Hope everyone's doing good. And I hope you fared well in your unit test one. Today's topic of discussion will be skeletal maturity indicators. As for the learning outcomes, at the end of the lecture, you should be in a position to define skeletal maturity indicators, explain the different methods to assess growth, assess the skeletal growth of the individual by skeletal maturity indicators, and also be in a position to discuss the importance of skeletal maturity indicators in clinical practice. So a brief introduction into what maturity indicators are and why are they important in orthodontics. So these are considered to be the most reliable method for growth assessment. And also when it comes to orthodontic purposes, they are closely related to the growth of the individual, and hence they will be of value when it comes to diagnosis, treatment planning, and also to know the post-treatment stability, especially in the adolescent group or the growing group. So basically what happens here is by understanding maturity indicators, you're able to determine and also understand at what phase a particular individual is growing at, or at what phase a particular individual is currently at, and then you can decide on appropriate treatment mechanics. So what are the requirements of a maturity indicator? So they should be safe, they should be non-invasive, and also expose the patient to a minimum of radiation. They should be accurate, and the stage of maturity should be easily identifiable. It should be a cost-effective approach and also easy to conduct or carry out, and should be valid over a time period and also across different age groups. Here you can find different types of maturity indicators normally used. So the first one is morphological age, second one would be sexual age, the third one is mental age, the fourth one is dental age, the other one is physiological age, and the last one is skeletal age. They're not in any particular order, so you may assess them individually or you can assess them assess several of them as a group. So I'm not going to go into the details of each. I will leave it for you to deliberate on them. However, assessing these maturity indicators using radiograph is the most common approach. So here, what all you need to understand, I've highlighted them in red so that you can concentrate on these three, but know the others as well. So one would be you have to be aware about growth spurt. You have to know about hand wrist radiograph and also about cervical vertebrae maturity. So basically, these are the three important things you will have to keep in mind, and also understand how it is done and what are the different approaches utilized in understanding growth spurt. What are the different methods employed in taking a hand wrist radiograph and how do you assess, and also what are the different approaches for assessing the cervical vertebrae. So what is a growth spurt? So it was Strom in 1982 who defined growth spurt as growth acceleration up to a maximum where the annual increment of growth exceeded the previous one by at least 0.7 millimeters. So any growth which exceeded the previous year's growth by 0.7 millimeters can be defined as growth spurt. Okay, so basically it has an acceleration phase wherein growth is occurring, and a deceleration phase wherein growth is either getting completed or is complete. So it has three stages. One is the infantile spurt, which occurs at year 3 in either of the sexes, and juvenile spurt occurs at years 7 to 8 in females and years 8 to 10 in males, and the important spurt, which is pubertal growth spurt, occurring at years 10 to 13 for females and years 13 to 15 for males. So this is the important one you have to know, and you can utilize this growth spurt while treating your patients, as uh, maximum growth changes do occur during this period of time. And it was Woodside in 1975 who observed this occurrence, and since then orthodontists worldwide have been utilizing this and treating their patients accordingly. So however, the best indicator for a pubertal growth spurt is the attainment of the peak height velocity, also known as PHV. So it is best to start the treatment during this phase, especially at the acceleration phase. However, you might need to consider uh, starting the treatment earlier in females, as they do have a growth spurt earlier than males. You now know what a growth spurt is. So now let's go into a little more details on what a hand wrist radiograph is, what are the indications of a hand wrist radiograph, and what are the different methods employing it in assessing hand wrist radiograph. So if you look at your wrist, you can understand that they are made up of numerous small bones. So these bones do show a predictable pattern of appearance, ossification, and union from birth to maturity, and hence it's uh, suited for studying and understanding growth. So what are the indications of a hand wrist radiograph? So in patients who exhibit major discrepancy between dental and chronologic age, if you perform a hand wrist radiograph, you will be able to understand what exactly is the correlation, or if there exists a correlation between the chronological age of a patient and the dental age of a particular individual. So it also will help you in the determination of the treatment of skeletal malocclusion, especially class 3 and class 2. It will also help you in the serial assessment and prediction of future skeletal maturation rate and status. Also to predict the pubertal growth spurt, the one which we just discussed previously, and also in patients with skeletal malocclusion needing orthodontic surgery. So these basically will help you understand if there is growth occurring, or if the growth has already uh, reached its final stages. So it will help you basically to understand if you can utilize this particular growth for the benefit of the patient using orthodontic treatment. Okay. Here you see an image showing the numerous bones of your hand. So it's divided into four groups: the distal ends of radius and ulna, the carpals. So I think you've already remembered this previously. If you know the mnemonics for carpal, she looks too pretty, try to catch her. So if you know that, you can remember what are the different proximal and distal carpal bones, then the metacarpals, phalanges, and the sesamoid bone of the thumb. Here we shall understand what are the different methods used in assessing hand wrist radiograph. So there are four different methods. The first one is Atlas method by Grulich and Pyle. The next one is Bjork, Grave, and Brown method. The third one is Fishman's method. The fourth is Hag and Terenger method. So what is Grulich and Pyle method? So they actually published an atlas containing ideal skeletal age pictures of the hand wrist for different chronological ages of both sexes. So here what you'll do is you will take the patient's radiograph and match it with one of the pictures in the atlas, and then come up with a conclusion. It's just that simple. The second method is Bjork-Raven-Brown method. So they divided the skeletal development into 9 stages, which are associated with a particular chronological age. So this is a little more complicated than the comparison with the picture approach. So here, stage 1 shows the epiphysis and diaphysis to be of equal length and width. which is in the posterior phalanx of the second finger. So you have to refresh yourself with a little more on the anatomical aspects of uh, the hand. So you'll have to remember the names of the bones. So only if you do remember those, then this methods will become more easier for you to grasp. So the next stage, stage 2, is seen when the epiphysis and the diaphysis of middle phalanx of the third finger are equal. Stage 3, you will see the calcification of hamate and pisiform bones, and also you will see the epiphysis and diaphysis of radius are of equal length. Stage 4 is the beginning of the pubertal growth spurt, so you have to be wary of that. And here you will see increased calcification of the hook of hamate, and also you will see the beginning of calcification of the ulnar sesamoid of the thumb. Stage 5 is the peak of pubertal growth spurt. Here you will see the capping of diaphysis by epiphysis in middle phalanx of the third finger, posterior phalanx of the first finger, and also of a radius. Stage 6 is when the person reaches the end of pubertal growth spurt, and you will see the fusion of epiphysis and diaphysis in the distal phalanx of the third finger. Stage 7 is the union of epiphysis and diaphysis in posterior phalanx of the fifth finger. Stage 8 will show the fusion between epiphysis and diaphysis in the medial phalanx of the third finger. Stage 9, here you see the fusion of epiphysis and diaphysis of radius, and this is the last stage. So there are basically 9 stages described by Bjork, Graven, Brown. So here what you need to understand is you should be able to identify the various bones of the hand and wrist, and then understand which area you're supposed to concentrate at and which area you're supposed to look at when understanding what maturity indicators are trying to show you or tell you. So you have to memorize these. So I would encourage you to draw a diagram and then mark each stage on it and try to memorize as much as possible, because that's the only way you will be able to understand and translate the same into your clinical practice. When you look at a hand wrist radiograph, you know where to look at, what to look for, and how to interpret the same. So that's the Bjork, Raven, Brown method for you. The second method is Juliens method. It was in 1980 this method was put forth, and it's a quick and easy method, and it has 6 stages uh, when compared to 9 stages in Bjork's method. So these progressive stages or steps are early, pre-pubertal, pubertal onset, pubertal deceleration, and growth completion. Stage 1 or early is when the hook of hamate and pisiform are still absent. Stage 2 is pre-pubertal. Here there are 2 things happening. One is the initial ossification of the hook of hamate and pisiform has started, and there is also epiphysis and diaphysis are of equal width and length in the posterior phalanx of the second finger. Stage 3 is pubertal onset. Here you have to know that there are 3 different things happening. So there is increased calcification of hook of hamate and pisiform. There is increased width of epiphysis in posterior phalanx of the second finger, and also there is beginning of calcification of the sesamoid of the thumb. Stage 4, 2 things are occurring, and one is the capping of diaphysis in middle phalanx of the third finger by epiphysis, and also there is the calcification of ulnar sesamoid. Stage 5, three occurrences or three things happening. First is the fusion of epiphysis in distal phalanx of the third finger. The ulnar sesamoid has calcified, and also the epiphysis of radius and ulna are not fully fused with the shafts. Okay, so you will be able to notice a radiolucent line between them. Stage 6 is the last stage. So growth has already completed, and there's no remaining growth sites present in the hand wrist region for you to assess. So that's Juliens method. So we shall go. The third method is Fishman's, proposed by Leonard Fishman in 1982. He made use of four anatomical sites located on thumb, the third finger, fifth finger, and radius, and 11 discrete skeletal maturity indicators were proposed by him. This method uses four stages of bone maturation. The first is the epiphysis equal in width to diaphysis, the appearance of adductor sesamoid of the thumb, capping of epiphysis, and the fourth one is the fusion of epiphysis. So here you can see stage 1, stage 2, and stage 3. In stage 1, the posterior phalanx of the third finger shows the epiphysis and the diaphysis to be of equal width, wherein stage 2, the medial phalanx of the third finger shows equal width of the epiphysis and diaphysis, and stage 5, you'll have to see the fifth finger, the medial phalanx on the fifth, the epiphysis and the diaphysis are of the same width. So this one here shows stage 4, 5, and 6. 4 is the appearance of the adductor sesamoid of the thumb. 5 is capping of epiphysis as seen in distal phalanx of the third finger, and stage 6 is the capping of epiphysis as seen in medial phalanx of the third finger. Here you see stage 7 and stage 8. Stage 7 is the capping of epiphysis in the medial phalanx of the fifth finger, whereas stage 8 you see the fusion of epiphysis in the distal phalanx of the third finger. Here you see the last three stages, stage 9, 10, and 11. So stage 9 is the fusion of epiphysis seen in posterior phalanx of the third finger. Stage 10 is the fusion of epiphysis seen in the middle phalanx of the third finger. And stage 11 is the capping of epiphysis seen in radius. So we've covered Fishman's method now. So now let's go to the next and the final method. The fourth and final method we will be discussing is the Hag and Terringer method. Here, the skeletal development was analyzed from annual radiographs taken between the ages of 6 and 18, and also three different bones were studied. One is the ulnar sesamoid of the metacarpopharyngeal joint of the first finger, that's the thumb, and also three epiphyseal bones, one in the middle and distal phalanges of the third finger, and also the third was the distal epiphysis of the radius. So here in Hagantir method, to understand the onset of peak height velocity, you'll have to look at the sesamoid bone, and then you will correlate it with the acceleration period of pubertal growth spurt. For the rest of the bones, you just look at the images and try to grasp as much as possible because it can be a little bit confusing. So for the third finger middle phalanx, the onset is when you see the epiphysis and metaphysis is of similar width, and this stage is attained before the onset of PHV in about 40% of subjects. So the next stage for it is the acceleration stage, wherein the epiphysis and the metaphysis are of similar width, and there's also a line of demarcation at right angles to the distal border, and this is obtained 1 year before or at PHV. You can see the image on the right hand side to better understand the correlation with the text. The peak stage is reached when the sides of the epiphysis have thickened and also cap its metaphysis, forming a sharp edge distally at one or both sides. So you can see it on the image more clearly. So this stage is attained at or 1 year after PHV. Stage 4, which is the deceleration stage, you see the fusion of the epiphysis and metaphysis has already begun and is attained after PHV, but before the end of growth spurt. And the end stage is when maximum growth has already occurred and there is no more scope for the epiphysis to grow. So we discussed about third finger middle phalanx. Now we shall discuss about third finger distal phalanx. Here there is fusion of the epiphysis and metaphysis and is attained during the deceleration phase of the pubertal growth spurt or at the end of PHV. The next bone is radius and is divided into 3 stages. Stage 1, there is fusion of epiphysis and metaphysis and is attained 1 year before or at the end of the growth spurt. Stage 2 is fusion is almost completed, but there can be a small gap at one or both margins, and stage 3 is characterized by fusion of the epiphysis and metaphysis. So now we've come to the last leg of this lecture. So we shall discuss about cervical vertebrae and why is it important to know about them and what information do they provide us with. So it was developed by Hassel and Farman, and here they looked at the shapes of cervical vertebrae, and they found that they differed at each level of skeletal development. So that's what interested them, and that's how they were able to understand that it has an implication with a particular age or growth of a particular individual, and also provides a means to determine the skeletal maturity of a person and therefore determine whether the possibility of any remaining growth exists or if there is any potential growth left for a particular individual. So 6 stages have been put forth: initiation, acceleration, transition, deceleration, maturation, and completion. So here we will discuss about stage 1 and stage 2. So stage 1 corresponds to the beginning of adolescent growth with 80 to 100% of growth expected. Here the inferior borders of C2, C3 and C4 are flat, whereas the vertebrae are wedge shaped, and the superior border tapered from posterior to anterior. So the images below are just a representation of the cervical vertebrae, and they should give you an understanding as to the different shapes and different surfaces of those bones. Now coming to stage 2, here the growth acceleration begins at the stage with 65 to 85% of growth expected. Concavities are developing at the inferior border of C2 and C3. Inferior border of C4 is still flat, whereas the vertebral bodies of C3 and C4 were nearly rectangular. Again, the image is just a representation, so don't go by the actual shape of it. It's just a representative image. So stage 3 and stage 4. So in the transition stage, it corresponds to the acceleration of peak height growth velocity with 25 to 60% of growth being expected. There are distinct concavities seen in the inferior borders of C2 and C3. Concavity beginning to develop on the inferior border of C4 as well, and the vertebrae bodies of C3 and C4 are rectangular. In the deceleration phase, it corresponds to the adolescent growth spurt with 10 to 25% of growth being expected. Distinct concavities again seen in the borders of C2, C3 and C4. The vertebral bodies of C3 and C4 are becoming more square. So the last two stages, maturation and completion. In the maturation stage, there is 5 to 10% of adolescent growth expected. The concavities are more accentuated and seen in the inferior borders of C2, C3 and C4. The bodies of C3 and C4 are nearly square or square in shape. And in the completion stage, little or no adolescent growth can be expected. Deep concavities were seen in the inferior borders of C2, C3 and C4. The bodies of C3 and C4 were square and both vertical and horizontal dimension, they are almost square. So this is a good representation of how the growth actually occurs. So you can see that there's a lot of growth occurring in the initiation and then lesser growth in acceleration, much lesser in the transition stage. In the deceleration, it's reduced to 1/4 of what was in initiation stage. Maturation stage again is half of the deceleration stage, and then finally completion. No growth is occurring as the bones have already matured and they've taken their final shapes and position. Here is an interesting image which shows the tooth mineralization method. Here you can actually see how the shape of the tooth has started to develop from image A all the way to H. So what you're seeing here is as the tooth develops and as the tooth mineralizes, you can also correlate the same with growth. So this will be the last method we will be discussing. So here you can actually determine dental age by scoring calcification of 7 teeth on the left side of mandible. So here you are seeing in A, the cusp tips are mineralized but have not yet coalesced. So they are mineralized but they have not formed one unit as a whole. In B, the mineralized cusps are united, so the mature coronal morphology is well defined. C, the crown is about half formed, the pulp chamber is evident, and dentinal deposition is occurring. In D, the crown formation is complete to the dentino-enamel junction. The pulp chamber has a trapezoidal form. In E, you can see the formation of the interradicular bifurcation, and also the root length is less than the crown length. Okay, in F, root length is at least as much as crown length and the roots have funnel shaped endings. In G, the root walls are parallel but abaces remain open, and in H, apical ends of the roots are completely closed and the PDL has a uniform width around the root. So this gave you a brief understanding and a brief idea as to how the dental age can be calculated by scoring calcification of 70 on the left side of mandible. With that, we've come to the last slide of today's presentation. So in today's lecture, we've learned about skeletal maturity indicator, what is growth spurt, what is a hand rest radiograph, and what is the importance of cervical vertebrae, and why do you need to study and assess cervical vertebrae maturation. Okay, so I think it has given you all a brief idea on why these things are done in orthodontics, what is the importance of them, and what clinical significance do they carry. So with that, we shall wind up today's lecture. I hope you guys are maintaining good social distancing and personal hygiene. Please do take care of yourself and follow the social distancing norms very well if you want to get back to your classes soon, and if you want to continue your normal way of learning as before. All right, stay safe and take care, and see you in the next lecture. Bye.